بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد وآله وصحبه أجمعين. It's very good afternoon, ladies and gentlemen. It's my pleasure to be here in this beautiful summit, and we wish if this summit will be organized every 2 years that we will be able to gather in supporting the manufacturing. Today I'll be talking about the global and UAE healthcare and the pharmaceutical industry, an overview, and to find out where we do stand as United Arab Emirates and what is the vision of the United Arab Emirates in terms of supporting the medical and the pharmaceutical industry. Let me bring you up in understanding what's going on globally. In fact, it has been indicated globally that the health expenditure will probably reach to 8.7 trillion US dollar. And this is very interesting to know that the number is increasing rapidly every year at the rate of close to 5 to 8%. It depends upon different regions. And this will be supporting the GDP from 10.4 to 10.5% by 2020. Although it has been also indicated that where this has been distributed in terms of the increment and percentage by health expenditure, and it has been indicated that the majority will be in the transition economics, and the transition economics has been indicated that will be concentrated on the emerging countries, and United Arab Emirates and Saudi Arabia. It has been indicated that it's among the top emerging countries that their economies by coming 5 to 10 years will be amazing and will be developed not only in the pharmaceutical or medical field, but in different fields away from oil, because I'm quite sure that you know that United Arab Emirates, we had a retreat chaired by His Highness Sheikh Mohammed bin Rashid Al Maktoum, Vice President, Prime Minister, ruler of Dubai, and also Sheikh Mohammed bin Zayed Al Nahyan, the Crown Prince of Abu Dhabi, did the retreat to go beyond oil, and we look forward that to celebrate the last barrel of oil to be exported from United Arab Emirates to outside the Emirates. And it has been indicated that 7.5% is the increment in number and percentage of the health expenditure in our region. Although the overview of the global health spending, rising demand, and mainly in NCDs, I'm quite sure you know that non-communicable diseases are not a major issue for the World Health Organization and for the United Nations. The NCDs are the major top issues, and on the top of it is the cardiovascular disease, which diabetes, hypertension, and the rest of it, due to the change in the non-healthy lifestyle, and depending upon the junk food and unhealthy lifestyle, which it raises the NCDs. But we have the plan that how to bring down the NCDs and to make sure that the health expenditure will be increased, but to control the quality and the value. And the rising demand associated with many things, an ongoing aging population, the life expectancy is very much increasing, growing prevalence of chronic diseases, and also development, costly clinical innovation. The new innovation, although it's very costly, but at the long run will bring down the cost. And although the public awareness, the knowledge of the patient, again, will brings up his expectation, which it means that the expectation of patients last 10 years is completely different than his expectation from healthcare industry 10 years later. And then what is the needed in the healthcare sector? And in terms of the NCDs, the Middle East has the highest rate of expected health expenditure, which it will reach to exactly 9% every year. And this is really indicated that by 2018, 9% will be the increment in health expenditure. Although I will tell you that the health expenditure is raising up, but on the other hand, the healthcare cost reduction, it's very taken care by the governments, that we have to bring in the cost, but not to losing the quality, and to make sure that the aging population, growth of emerging market, and advanced end transaction or innovative technologies will be raised up, and to make sure that the quality not to be lost. I will give you an overview of global healthcare drives. What drives the overview from the global perspective that it supports the health expenditure to be raised in this region. On the top of it, that 50% of global healthcare expenditure, which is about almost $4 trillion US, will be spent on 3 leading causes of death. Number 1, cardiovascular, as I said earlier. Number 2, cancer, which is 60% of the cancer cases is unknown. What's the reason behind? Either acquired or environmental. And the respiratory diseases. The number of the diabetes, which is a part of the cardiovascular disease, it's being expected to be increased from 415 million cases by 2040 to almost 642 million cases. Aging, as I said, due to the high standard of healthcare services in this region, the ages is being rising even in the developed countries. But there are other pillars that really it plays a great role in supporting the healthcare, quality of healthcare, and the health expenditure, but not to lose the quality. On the top of it, the quality of operations, care delivery, cost, innovation, regulatory compliance. Now, in any of single countries, if you don't have strong regulations to support the innovations, to support health expenditure, to support the new innovations to be introduced, to support the new technologies, and to support the foreign investments to bring in, really that country will not be succeeded. And I will give you, for last 2.5 years, we were able to have 14 number of new regulations signed by His Highness the President, the Federal President of the country. On the top of it, the medical liability law that protects the patient and the health professional together, organ transplant law, the medical services law, and many new laws. Among that is the telemedicine that we will allow the physicians to treat their patients as in distance, especially with the patients with the chronic diseases. And I was talking about the NCDs. NCDs really brings a huge burden, economical burden on the governments. 55% of the direct cost comes to the government through the NCD cases. But there are some other indicated burden has not been taken care in some of the countries, but has been indicated by the United Nations that 45% of the burden comes on the governments through the productivity of that single person if he is among one of the NCD cases. And therefore, it's very important that for the governments to bring down the number of NCDs, the prevention of different type of diseases is very important. Public awareness is very important, and very important on the top of it is the public awareness among the youth, the children at schools, universities, to make sure that they will be protected from obesity, diabetes, hypertension, and rest of the diseases. We cannot do that unless we have a strong prevention program and the public awareness. His Highness Sheikh Mohammed wanted to send a message to the not only to the population of United Arab Emirates, but to the governments, that the health of our citizens cannot be measured by any cost, and treatment is a vested right for them. This is very clear that we as a government, you as a private sector, together we could join the efforts as a PPP, public-private partnership, to provide our nation, the population of United Arab Emirates, with highest quality of care, and this is a vested right for them that to get the highest quality. And therefore, it's very important that to make sure that we have to pursue the outcome-based healthcare. It's very important to understand what is the outcome of the healthcare services which is being provided from both governmental and the private sector. And this really goes aligned with not only the federal government vision for the future by 2021, which will be completing 50 years of independency since December the 2nd, 1971. But this is some of the examples that even the local governments going aligned with the federal government's vision for providing the healthcare services. And the top of it is to bring in the new industries, bring in new innovations, and to support the pharmaceutical industry and medical industry. Whenever I say pharmaceutical industry, is the new innovations in bringing in the production of innovative medicines, generic medicines with the new technologies like biosimilar, biotechnology. And whenever I do say the medical industry, which it means the new hospitals with the new technologies, and I'll give you a few examples that Abu Dhabi government were very much supportive to the medical industry that they bring in Abu Dhabi Cleveland. That's one of the examples. Johns Hopkins, which they're running Sheikh Khalifa Hospital in Abu Dhabi and Tuam Hospital. We have Seoul National University of University Hospital from South Korea. They are running Sheikh Khalifa Hospital in Ras Al Khaimah. We have Global Health from Sweden. They are running Sheikh Khalifa Hospital in Ajman, Rashid Diabetic Center, Masfood Hospital. We have Mayo Clinic. They have a joint venture and affiliation with American Hospital in Dubai. Just those are examples how much the local and federal government are supportive to the, not even the pharmaceutical industry, but also to the medical industry. And those are some of the examples that how much we do goes aligned also with the global SDGs, which is good health and well-being is the major part of the global SDGs that to be taken care of each single government, and we do go align with that indication by the United Nations. In fact, let me talk about my country, my beautiful country, the United Arab Emirates. I will try to discuss some of the small points among those 8 pillars has been mentioned to you. Let me talk about the healthcare industry in terms of the facilities. We have 135 private and governmental hospitals in the country. And there was a vision from His Highness Sheikh Mohammed bin Rashid Al Maktoum that by 2020, all the hospitals must be accredited internationally. And I will say out of 135 hospitals, 64%, which stands for 83 hospitals, governmental and private hospitals, are accredited either by JCI or Canadian. We don't stick to JCI or Canadian, but you have Australian and you have the other one. And this is a strong indication that how much since 2014, now we are in 2017, just 3 years, 3 plus 3 years, we were able to reach up to 64% of our hospitals being accredited. Although we as a Ministry of Health modified our system that to include not only the hospitals, but one daycare surgery hospitals, IVF centers, and I will announce here today that we are the only country in the world that we have the complementary medical center accredited by JCI. And we received an official letter the day before yesterday from JCI, Dr. Ashraf, the regional director, that we have the only center in the world as a complementary medicine JCI accredited in the world. Despite that, the infant mortality rate, we are almost one of the lowest, 6 per 1,000 live birth. This is a good indication for you. Although the population is increasing, we are almost above, by the way, it's mentioned here, 9.2 million. We are almost 10 million population. And we do expect by Expo 2020, which probably will be expecting the people from more than 180 nationalities, that the number of population by 2020 will reach to 14 million here in United Arab Emirates. Emirates has been ranked 28 among 149 countries about the healthcare and quality index, and that's very good indication for you to understand where to take your investment, where to bring in your investment, and where to live also. Let me talk about the United Arab Emirates health expenditure. In 2015, it was 56.2 billion Emirati dirhams, jumped to 59. It has been forecasted that 2020 we will reach to 73.5 million Emirati dirhams, and then by 2025, 101. And this is a strong indication how much the government of Emirates is supporting the health industry. And by end of 2015, the government of United Arab Emirates, the federal and the local, used to cover the health expenditure in terms of 66%. And the rest of the 33 was from the private sector. We jumped, or it's not jumped, it has been reduced to only 52%, which it means that we are allowing the private sector to come up and to bring in their investment here. If I will talk to the pharmaceutical, because this is a major part of our industry here, so far we had 14 factories in 2015. 2016 we jumped to 16. I have 18 factories. Initial approval has been given, which by 2021 we will be, or 2020 we will be having 34 factories, the highest in number and quality at the level of Middle East. And the pharmaceutical market value were 8.8 billion, jumped to 9.6 expected, forecasted 13.13 by 2020. And this is a great support for you, that where you need to put your money, and the legislation will bring you a good support. This is a very busy slide, but I will give you a small example. BMI stated in 2016 that the import market value for pharmaceutical industry was 8.7 billion dirhams, and it will jump to 9.8 by the end of 2016, but it was above their expectation. They stated January 2017 that the import market value from expected 9.8 jumped to 14.1. This is a strong indication that how much we are supportive to the manufacturing and to the manufacturing industry. I was talking about the factories, which we are the most fastest country in supporting by regulation, by the infrastructure, by the logistic hubs which we having here, by the 5 MOUs was signed between international pharmaceutical factories and the local pharmaceutical factories to produce above 100 products, innovative medicines in the Emirates since 2013 to now, and we have 2 in the pipeline. We will be reaching 34 factories, but we are very much supportive to the international pharmaceutical and medical companies to have their scientific offices representing their company at the level of MENA region, Middle East, Northern Africa, and above that. And by end of 2016, it was 53 scientific offices. It will jump, expected, to 75 by 2020. And this is a small slide that how much the medical industry is very much supportive to the health, and we have a demand of above 50% of physicians, and above that of nurses demanded by new hospitals that are coming up. We have so far 6,000 hospitals and health centers on the private sector, only licensed by 3 health institutes, Ministry of Health, Abu Dhabi, and Dubai Health Authority. And this slide shows that how much the demand is increasing by 2020 in all health professionals, pharmacists, and the rest. What it supported those improvements in United Arab Emirates? It supported that we have the most liberal trade regime. We are one of the most developed countries in terms of supporting the infrastructure healthcare at the region. We have a strong strategy in supporting the health legislation. We are one of the most fastest accelerated drug registration. The majority of the drugs innovated as soon as being approved by FDA or EMEA. We were either the 2nd or the 3rd or 4th country to introduce that drug to the Emirates in just 3 days or 1 week or 2 weeks, and that's a great help for not only that international pharmaceutical company, but it's a great help for medical tourism, that the patients from the region and above the region could come and take their treatment here, because those drugs are available. Despite that, increment in number of population, and also the local manufacturing companies, the number is increasing rapidly. This will lead us to talk about the PPP, and I gave you some of the examples, the PPP for the hospitals, Cleveland, Abu Dhabi, Seoul National University Hospitals, Johns Hopkins, Mayo Clinic, and the rest. I'll give you small examples in joint venture between local and international pharmaceutical companies to produce innovative medicine as per the support of the Ministry of Health. Merck Serono and Pfizer, they had an MOU with New Pharma in Abu Dhabi. Julfar had with MSD in Ras Al Khaimah, Sanofi and Global Pharma in Dubai, and there were many others, and soon Abbott and Roche and other companies are coming up to sign an MOU to produce innovative medicine. And this is really a good example and evidence that how much we are very much supportive to the PPP. What have been said, it goes aligned to the national agenda vision, which is being focused in 6 main pillars for the United Arab Emirates. On the top of it, number 4, which is world-class healthcare to be provided to the inhabitants of United Arab Emirates. This is the vision of our the most visionary government in the world, and I always say that we have to join efforts together, and whenever which it means the government and the private together, and to raise the quality, to raise the standard, and we cannot do that unless if we all together join the efforts. Recently, we signed an MOU with the Dubai government that to allow the foreign companies to have 100% ownership in producing their medicines, their medical equipments, their medical instruments, and having their factory in Dubai. The same will be signed in Abu Dhabi government, 100% ownership. This really will support the manufacturing, both the medical and the pharmaceutical, and bring in the international companies to have 100% ownership of their properties, their premises, their businesses, and their investment. And really, by having the updated legislation, we will be able to bring in the new technologies and to bring in your industry to the United Arab Emirates. And from here, by having the logistic hub for your products, by having strong infrastructure, different airports, different free zone areas. We have 53 free zone areas, by the way. We are the only country in the world that we have open free zone. You have Dubai Healthcare City, that's open free zone for health. You have Media City, you have many open cities that it supports you to bring in your investment and your technologies, which the new regulations goes aligned with the international innovative ideas and bring in the new technologies to the Emirates. I always end up my presentation with this beautiful photograph, what it joins the both together, the both two leaders, supported by Sheikh Khalifa, the President of the United Arab Emirates, that though both Sheikh Mohammed bin Rashid and Sheikh Mohammed bin Zayed, the most visionary leaders, that they would like us to be #1 in the world. And we have to strive at this most developed world to bring in the highest technology and to bring in the most competitive technologies in this competitive world, and to join the efforts together to become one of the best countries in the world by 2021. I don't want to take much from your time, because we have been decided with my brother, Mr. Simon, to give a chance to the audience to bring up their ideas, their suggestions, and to raise the points that it could elaborate in having the new ideas to support the manufacturing and the new industries in United Arab Emirates. Thank you very much.
Invite the rest of the panel up on stage. I wanted to follow up on something you spoke about regarding technology, particularly as it relates to non-communicable diseases, which are becoming more important, particularly in this part of the world. People often talk about the role that new technologies, perhaps new surgical techniques or new drugs might be able to have for NCDs. But there is a risk that can come at the expense of some lower cost and more traditional solutions, say, I mean, in relation to diet or exercise. As a regulator, how do you think governments can take advantage of new technologies, but without imposing unnecessary costs on their system by ignoring some of those basic solutions?
Excellent, Simon. That's a good question. In fact, I think each single smart government should put their decisions by introducing new regulations that could go align with the new technologies which has been developed by and approved, and I will say approved, that's important. There are many technologies being came up by different countries, which is really, it's not being approved either by FDA or not by EMEA or not by TG in Australia or not has been CE marked. Those technologies has an really strong imaging, strong, I can say, non-evidence-based, I can say, issues which really could bring harm to the human being. But what we are doing in the United Arab Emirates we have something called Emirates Medical Council, which is chaired by His Excellency the Minister. We have members at this council, which is Director General of Dubai Authority, Director General Abu Dhabi Authority, Dubai Healthcare City, Sharjah Healthcare City, the military, the defense, and the Ministry of Interior. Despite that, we have 3 members from the private sector. Dr. Shamsheer is one of them, that we bring in all the new regulations. We will not release any regulations from that council to be raised to His Highness, either the Federal President or the Prime Minister, without making sure that those regulations will go aligned to the new technologies, the approved technologies, which really doesn't bring harm to the to the inhabitants, to the Emirates community, but brings the new technologies, fastest technology like Da Vinci, which is for the open heart surgery, is being introduced recently in one of our governmental hospitals. The other technologies, which I did approve yesterday for one of the private hospitals, that this technology, it supports the patient with the chronic disease, that, for instance, if they had a first visit with their physician, by new technology, they can give them the consultation 2 weeks later, and they can adjust the dosage of the medicine for diabetic patient, hypertension patient. By this technology, they can indicate what is the sugar rate, the blood pressure, the cholesterol rate, while that at their house, minimize the cost on the insurance companies, minimize the cost on the single individuals, and even to minimize the efforts from the patient and not to come to the hospitals. They could give him the proper guidance by this new technology. You know, we don't bring in any technologies unless if it is evidence-based, and we do align our regulations with the new approved technologies.
Okay. Let's now bring up to the stage the rest of the panel. So Dr. Shamsheer, Vayalil from VPS Healthcare, and Jean-Paul Schenner from Sanofi. Shamsheer, if we can begin with you. So picking up on some of these topics, and we've just spoken about the role of technology and the and how to manage the costs associated with that. I mean, maybe you could share with the audience your thoughts or on the topic of value-based healthcare, actually what that means beyond being a buzzword, and what the implications might be for people involved in manufacturing in the healthcare sector.
I think if you look at the whole healthcare landscape, the concept of value-based care is now ringing bell everywhere we go. We go to any country, they talk about the cost, they talk about outcomes. So now the only way to achieve it is to embrace technology. So with that, what I mean is use of the artificial intelligence, big data, use of algorithms, and it's all happening in front of us. So the healthcare industry particularly is very risk averse. You don't see major disruptive breakthroughs happening in the healthcare industry. So we expect somebody from outside of the industry, especially companies like Apple or any of the smartphones, which could come through and come up with a technology which could disrupt the whole healthcare delivery platform. So I think what we have not seen in the last 100 years, we would see much more than that happening in the next 10 years. So the advantage of this region is having the visionary leadership and a strong regulatory framework which encourages innovation, which encourages new concepts, new modalities, and as Excellency said, the regulations embraces the technology rather than the other way around. So there is a big potential which can keep UAE as the capital of the healthcare in the world. What I mean is manufacturing, good facilities. We are on the ground. We have started with one hospital, and now we have a chain of hospitals across GCC and India. We are able to attract talent, especially having that advantage of hedge between India, GCC, and the neighboring one-fourth of the humanity, which is around 3-hour flight distance. So with that, we are able to leverage the technology with the human intelligence. So we feel that there is a lot more to look forward, and with the leadership in place, we are very happy to do innovative things.
Okay. And Jean-Paul, if we just broaden out beyond the Middle East perspective, although I know, of course, you are the GM for the Gulf region, but Sanofi is obviously a pharmaceutical innovator, but also a manufacturer. What are the kind of factors that are important for you when you're thinking about where to manufacture? What's important? Is it distance to market? Is it proximity to innovation? Is it low production costs? Something else?
So basically, there would be, beyond the production costs and so on, 3 major bases for which we would be investing. In the manufacturing capabilities, whether through an acquisition from a greenfield or with a localization of few of our product partnership with the local companies. First one would be, of course, the size of the local market, which we have been doing, for instance, in big markets like Brazil or in Mexico, in Russia, in China, of course, where we own we have our own manufacturing capabilities. We made some significant acquisitions, sorry. So, I mean, that would be one of the first reasons to do it just by itself. The second one, of course, is an improving of the access to market. And you have some countries which are also obliging you, actually, if you want to have access to public market, in particular to localize part of your production. This is the case in a lot of countries. This is, for example, the case in Saudi as well. And you have also, I mean, the third reason is that you could use a country as a hub and actually for exporting your products to the neighborhood. And this is, for instance, the case of what we would do in the UAE. Sanofi has been making, as it was mentioned by His Excellency, actually a major investment in the UAE. We've made an acquisition in summer 2014, where when we acquired a company called Global Pharma. And basically, this was not done only due to the size of the local market, obviously, but more because we had the possibility to reach out GCC market, but not only, also African market, actually. And this is obviously one of the key reasons why we've been doing this. And to do so, what do you need? You need a very good regulatory frame, which we find in the UAE, I mean, being absolutely, I mean, welcoming and fantastic, actually. Very high level of quality of manpower, very good pharmacovigilance and quality system, very good, I mean, patent protection.
About regulation, what are the next boundaries of regulation that you think countries are not really yet thinking about, but they will need to think about for the healthcare systems of the future?
Well, if I take, I mean, again, the example in a region here, but it can apply, I mean, to a lot of others. What we still do not have really is an easiness of access to market to the region, actually, and particularly within the GCC, even having a localized production in the UAE, actually. There is not yet a lot of harmonization at that level. And the fact that you have a manufacturing facility in the UAE doesn't give you an accelerated registration process, for example, in other neighborhood countries. And I think this kind of changes and harmonization would definitely make this market much more attractive in terms of localization of manufacturing.
Yeah, okay. I'm going to soon sort of call out to the audience and ask you for some of your questions. But perhaps, Your Excellency Dr. Al-Amiri, what's your response to the need for cross-regional kind of integration in terms of regulation? Is that something that you're discussing with your neighbouring countries, or something that's off the table?
Yes, as Dr. Jean-Paul said, harmonization of regulations among the region probably will support the industry and will support the international medical and pharmaceutical companies. Now we are into the process. I was in Jordan. They had a big conference for they call it the Jordanian FDA. Was the Prime Minister was there. And I was behind requesting that all the region, we should have reference countries. For instance, if they consider Emirates as a reference country for drug registration, which it means that if one of the drugs is being registered in the Emirates, should go to the rest of the countries in the region immediately without having to wait under the queue or to be in the pipeline of the registration. Immediately the same certificate must be accepted. And this really, it will fasten the process of bringing in the drugs which is being registered in the Emirates to the rest of the countries like Saudi, Kuwait, Jordan, Lebanon, and the rest of the countries, which it means you don't need even to go under the process. You just pay the fees and bring in them. Secondly, I will come back to the comments of Dr. Shamsheer, which it aligns to your question. Yeah. Now, the legislation goes aligned with the new technologies, and I'm quite sure if any one of you visited our booth during the Arab Health, we introduced among the technologies which is being introduced by us, we introduced two things. The first thing was the mirror. You fix this mirror in your toilet. As soon as you wake up early morning, you stand among the mirror. In 5 minutes, your vital signs will be measured and will be transported or transport immediately goes to your file, to your physician. Your blood pressure, your pulse, the level of the sugar, the cholesterol, and the rest of things which is needed.
Mm-hmm.
And this is being now, will be introduced in the United Arab Emirates, because this technology soon will be approved by FDA.
Mm-hmm.
And then we are aligning from now to have the legislation which allow this technology to be introduced in our hospitals, that they have the software, and the physician, if he sits in his office and in the hospital, will be able to give the feedback to the patient why he is he is in his toilet. The other thing, we found a new technology, the stethoscope. Usually you try to use it to measure my blood pressure with BP apparatus.
Mm-hmm.
That stethoscope will do ECG as soon as you'll put it in my chest in just a few minutes. That's a new technology, and it needs to be introduced to minimize the...
Since we'll run out of business if you bring all these technology, then...
and the most important is that immediately we decided to register those. You know, I'm quite sure Dr. Shamsheer knows. We introduced 2 new legislation to support the industry and the manufacturing. Mm-hmm. Number one, for the local manufacturer, we allow them to submit the file of the new drugs, new generic drugs, for the patented drugs, which it will expire 2 years later, 24 months before the expiration of the patency of that drug, that they will do the bioequivalence, stability test, everything, and the file will be ready. We give them the approval for registration, except the pricing, that he cannot market that drug. If January 1st, 2018, that drug will be expired, which is patented by FDA, January the 2nd, 2018, Dr. Shamsheer's drug will be in the UAE market and the region. The second thing, for the international companies, we allow them that to submit the dossier for the non-approved FDA drug to the Emirates. Is it true or not, John Paul?
Absolutely, we have a good
You will
example.
submit the file, we will approve that, we will give you everything except the pricing. As soon as FDA will issue you the certificate today, tomorrow your product will be in the market, which it means 24 hours only. This is none of the countries in the world did this for the local and international pharmaceutical companies.
So the UAE essentially is accepting US certification for drugs as equivalent for giving access to this local market automatically.
That's right.
Would you also, I mean, you mentioned before about a sort of a sense of GCC version of that. You mentioned sort of could Emirati certification be used in other countries? Would you accept that in reverse? Would you give a drug approved in Kuwait or Saudi automatic entry into this market?
For sure, because Saudi and Kuwait are a reference country.
Mm-hmm.
Any drugs. I mean, I do accept if this will be approved by the ministers of health in the region. And
mm-hmm.
I wish if this could happen. And I'm behind this. Me and my minister, we were in Cairo 3 weeks back, and the ministers meeting for the Arab region, and I was really supporting the idea, and we took a decision there that any factories which is being GMP certified from any of the Arab countries, that GMP certification will be accepted and must be accepted than the rest of the countries. You don't need to spend more time and efforts to go and do a GMP inspection. And I raised the point that please accept the drug registration in the reference countries. For instance, if Jordan, Morocco, Saudi, Kuwait, Emirates are reference countries in the Arab region, if the drug is being registered in one of those reference countries, must be accepted by all Arab countries immediately without requesting them to register there. Just they have to pay the fees, and that's it.
Okay. Let's see if we can come out to the audience. We've already got one hand up there. Maybe just say where you're from, and then ask your question to the panel.
Okay. My name is Dr. Amin. I am a former fellow of the United States FDA, and currently I am in a clinical research consulting organization in Washington, D.C.
Mm-hmm. And your question?
My question is for His Excellency. You've spoken eloquently about the regulatory effort in UAE about the drug registration and the post-approval and post-marketing framework. I want to focus perhaps on the pre-approval process related to the clinical trial, phase 1 to 3 part of the drug regulatory process. I know that part of the drug regulatory process is still evolving in the region, and I would welcome your remarks about this in the GCC region and particularly in UAE, what is the vision regarding that part of the drug life cycle? Particularly the clinical trial. It's a clinical research industry, so it's quite relevant to the remarks you raised.
Thank you, Dr. Ashraf. This is a very valuable point. In fact, clinical trial is one of the hotspot issues worldwide. We used to approve accept the clinical trials for the non-approved drugs phase 3 and 4, but now we came back through the higher ethics committee that we are accepting phase 2 but not phase 1 because we don't have a research center to value and study what is the outcome of the clinical trial phase 1 but phase 2. And despite that, we are, I think, the only country in the region that we accepted, because it was signed by myself, accepted the non-approved drugs under the clinical trial phase 2 to the patients for the critical cases which they are resistant to the existing drugs available, or there are no specific drugs to treat some of those crucial cases. We brought in some of those drugs non-approved by FDA or by EMEA. It was under the clinical trial phase 2, and mainly for a disease called MS. I'm quite sure it's very known to you, which it means that our country is very much open, not only to clinical trial phase 4, 3, 2, but also to bring in to use the drugs for the critical cases, which there are no substitute with the existing drugs worldwide, or the cases which the patient has a resistance to the available approved drugs.
You've talked a little bit about openness in terms of sort of regulatory environments and I guess also trade for healthcare. I mean, this is something that came up this morning, particularly in our panel of politicians that we had speaking, where there were some concerns raised by some of them that the international environment was becoming less conducive for sharing, and that maybe there were more trade barriers and countries were less willing to sort of cooperate in a regulatory or other way across borders. Is that something you see in the health sector, or is the health sector an exception to that trend?
I think health sector is an exception, and I give the examples that how much we are supportive to the patients, even if the regulation will not allow that. But if the patient's need is there, I'll give you a small example that we have drugs which is non-registered. And because the international companies, they don't like to register that drugs because the use in the Emirates, due to the number of population, number of cases, are minimal. Therefore, they are not interested to come to this market. Although we have the majority, but there are some that are not interested to come to this market. But there is a need for patient. The law says it's not allowed to import a drug unless if it is registered by the Ministry of Health. But I don't want to say we go against the law, but we align ourselves to the law that while there is a need for the patients, then the legislation and the law should go align to the need, and we bring in those drugs, which it means we are very much open to the international guidelines, and we are very much open to say that the health has an exceptional, because our main concern is the patient safety. And I think the decision of the government was that all hospitals to be accredited internationally, either by JCI or Canadian or Australian by 2020. Otherwise, we will close down the hospitals. Any hospital which is not accredited internationally by 2020, and not only accredited, sustainability of accreditation. Yeah. That if today it has been accredited in 2014, they have to assure to us that 2015, 16, 17, it's an ongoing process, and this really brings up the highest and one of the most important issues to the human's health is the patient safety, because patient safety is a major pillar of the international accreditation.
Any other questions to the audience down the front?
I run the Brazilian Innovation Center on 4.0. And my question is the following. 2 sessions before we had a food and beverage session. And in this session, you spoke about the main diseases like cardiovascular, cancer and respiratory diseases. You spoke about advanced and accredited world-class hospitals. And at the beginning sessions yesterday and tomorrow in the morning, we spoke about social migration, sustainable worries concerned with 4.0. My question is, food and healthy behavior, is that something that from the healthcare area you are studying the link and trying to make the best of this so that you can also reduce expenditures and other things only by eating better, like an example?
That's a very good question. I will give you two examples that what United Arab Emirates is doing. Number one, who read the newspapers today? Arabic and English. None of you?
Only the Arabic ones.
No, even in English. In fact, let me go to the second example. The second example that due to the importance of food, quality of food, which again, it reflects quality of healthcare, health of the human being in the Emirates. The government of the Emirates decided that the Ministry of Health will be a member, as a main member at the higher committee called Higher Committee for the Consumer Protection, and a member with the Minister of Economic. We meet once every 2 months, and we discuss about everything which relates or connects food with the human's health. And we again have a strong program with Ministry of Education, Ministry of Economic, our ministry, health authorities, and the universities for the youth awareness in schools, that how to convert their practices from I can say non-healthy lifestyle to the healthy lifestyle, to protect them from being obese, diabetes, hypertension, and to avoid the junk foods, avoid the laziness, or to go to the sports services, and again to avoid the soft drinks, avoid the energy drinks, and many things. I don't want to go into the details. The other example is that today it's in all newspapers, and last night in the TVs, and tonight I have 2 interviews in the TVs, that anything which come up through the social media, and now social media, it's a point of business, it's a point of how that you could reach to the million or billion of the people in just an hour or in a minute. It came in a social media for last week that a lady in the States stated that she had a cancer, and she fed up from taking chemo and radiotherapy, and suddenly she discovered there is a vitamin called B17. She used that vitamin, and recently she came back from the hospital, and his physician, the oncologist, said, what you did that your body's free from cancer disease. This B17 were able to fight against the cancer cells, and now your body is clean from cancer cells. I advise you to go and use B17, even prospectively and retrospectively. Even if you are not a cancer case, you could take it to protect yourself. We did a study immediately, and I was communicating with all the oncologists in my country, and we communicated because through the pharmacovigilance, which Dr. Paul John mentioned, I'm chairing the higher committee in the country, we found that B17 was banned by FDA, was withdrawn all the products which has B17, and B17, although it is not vitamin, we know B complex, B1, B2, B3, B5, B7, B9, B10, 12, but there is nothing called B17. Although it is like a sort of a supplement, you could get it from fruits or from some of the roots of some of the trees, but it's very toxic. It has a cyanide, and if you will take a high dose, probably will kill you. And immediately what we did to protect the human's health in United Arab Emirates, immediately today it's a half-page announcement to advocate this issue. All the newspapers, Arabic and English, TV, radio, and everything. This is a good example for you that how much we are supportive to the human's health in the United Arab Emirates to make sure even we control. We were, by the way, the first country in the Middle East that to have a medical advertisement law, 2007. Decree number 7 from the minister's cabinet, His Highness Prime Minister, and then the new decree 2014, and we control the social media. Although social media should be used positively, but unfortunately is being used negatively.
Well, on that cautionary note, I'll have to draw the panel to a close. Thank you very much.
Thank you.